Hi, I'm Jonathan Vasquez, senior at Millikan, getting my bachelor's degree in Bachelor's of Science in Health and Fitness. Today I'm going to talk to you guys about the importance of resistance training for older adults. But before I jump into that, I want to talk to you guys about why I chose this. I've actually been influenced and enlightened by a personal trainer from my practicum class. His name's Zach, works at BMH. He actually enlightened my train of thought process towards working out for older people, what they can do. I mean, usually by the American Heart Association, they only prescribe cardiovascular workouts for older people. And I didn't know the benefits of resistance training for older adults until I kind of met up with him, spoke to him. He gave me some articles to read. And also, coming from like a Hispanic Asian descent, with a lot of aunts and uncles and grandparents who are 40 plus, and like I said, coming from that, we tend to eat good. We eat real good. And with that being said, that means we probably have a lot more spices, flavors, which also means that we have high sodium, high sugar, lots of carbs. I mean, Asian, we probably have rice every meal. But yeah, that's pretty much why I wanted to talk to you guys about this. I feel real compelled towards working with older people. I think for the most part they like to listen, the ones who do want the help. But yeah, what is resistance training? Resistance training is any exercise that causes the muscle to contract against an external force. And what I mean by that, I'm going to give you guys a demonstration. An external resistance can be anything, like I said. I'm going to use this chair as an external resistance. And the muscle being contracted will be my bicep, the main muscle being contracted. And as I lift, my muscle being contracted, and here's the external force, putting resistance on the muscle. As you can see, external resistance come in all shapes and sizes. They could be a bag of sand, they could be a jug of water, it could be a bag of bricks, a bag of rocks, like you've seen in Rocky IV. But the ones that we tend to focus on in the gym, at least, there are 4 types, and that types are free weights. Free weights consist of your bench set, your squat rack, and pretty much when you walk into this, anything on that black mat, that's your free weight section. Next, you have your cables. Cables are just like free weights, except they provide a little more stability. So it gives you the same motion as a free weight, with just, like I said, a little more stability. Then we have your resistance bands. Resistance bands are one of my favorite. They're actually, to me, they're my favorite because when you ask an older person, hey, we're going to do some resistance training today, they might get a little intimidated thinking we're going to lift some weights. Then you lay out the band on the table, they're like, oh, here's another type of resistance training. You know, some people, I think you fear what you don't know sometimes. And that's why I would like to bring that out initially, show them there are different types of resistance training methods. And on top of that, it's actually great for rehabilitation programs, shoulder injuries, hip injuries, knee injuries. Last but not least, you have your body weight. Body weight is also a great resistance. For older people, generally 60 plus, they tend to have problems getting up and out of a chair. And one workout would be just simply sitting in your chair, sit upright, chest out, and just hands to your side, just practicing getting up, just straight up. Doesn't seem that hard, but for the most part, 60 plus people sometimes have trouble, or it's just by subconsciously you get up every time using your hands. I have a video to show you that, like I said, external resistance come in all shapes and sizes. It could be sand, it could be another human being. Here we have a guy who is going to show you what type of external resistance there are. stirring resistance is that young lady. So yeah, like I said, stirring resistance comes in all shapes and sizes. I don't know if using another human being would be quite accurate, but it works. Okay. Life without resistance. Here we have two pictures of pretty healthy men, I would say, from looking at the image. On the right side, you have a man who consistently works out in resistance training programs. And here on the left, you have the opposite end of the spectrum. You have a man who is a marathon runner, runs daily, consistently, but strictly only trains cardiovascular. Looking at the picture, who would you say is healthier? But don't answer that, because everybody has their own image, their own ideology of what health is. Some people might like the tall, lean look. Some people might like a little bit of a physique, tone, some size to them. But to me personally, I see this guy right here. He's got a smile on his face, and he's bald. And I mean, he's got a little tan, so looks like he likes to go out and enjoy himself. Well, over here on this guy, I mean, he's still pretty lean. You see all his muscles, all the striations. He's got his hair, but he's not smiling. And he's probably running, most people run, from what I've run into, is stress relief. It's a good stress relief, but I mean, he doesn't look too relieved. He looks pretty tired running as well. I have nothing against cardiovascular fitness, just to put that out there too. Let's see. I'm going to use this guy right here on the right for an example. I want to give you what life would be without resistance training. Say this guy right here injures himself during a lift. Say he's squatting and he tears his ACL. He's out for a year and a half, real bad injury. Now, coming from consistently working out, your metabolism is up high and going because you have muscle mass, which is active tissue that needs more energy than body fat itself. Now, coming from an injury, say a few months go by, starts to notice some physiological changes. He starts seeing that hardened body type lessen up. He starts to become more soft. His belly starts rounding out, losing his abs. At this point, he's having muscle loss, also known as sarcopenia. After a while of not working out, you tend to lose your body, you tend to lose muscle mass first. And that is typically the first sign of aging. As you get older, the first thing that usually goes is your muscle mass. And at this point, when you lose muscle mass, your metabolic rate slows down. And when your metabolic rate slows down, your metabolism slows down. And with that being said, that means more body weight accumulation, dead weight, not muscle mass. And with that dead weight, that could be anywhere from visceral fat, which is internal fat that surrounds your organs. And due to that, that can cause many implications. It can cause diseases, overweight, obesity, which leads to diabetes, cardiovascular disease, heart attack, the list goes on. But that's what happens when you don't, with life without resistance. Then you end up like that. Benefits of resistance training. There are a lot of benefits towards resistance training. Like I said, as you can see from the beginning, the process of not training resistance, your metabolic system goes down slower, you gain weight, and it leads to other diseases, obesity, and whatnot. Now you can take that cycle and flip it around, and you can have arthritis relief. There was a study done by Tufts University, recently completed, by a resistance training program with older men and women with moderate to severe knee osteoarthritis. The result of this 16-week program showed that strength training decreases pain by 43%, increased muscle strength and general physical performance, and improved the clinical signs and symptoms of disease and decreased disability. The effectiveness of resistance training to ease the pain of osteoarthritis was just as potent, if not more, than medications over prescribed medications. Another benefit is reduction of falls. Naturally, when you start resistance training, weight-bearing exercises, naturally your body becomes used to it, and it starts to, your bone density becomes dense again. As people age and poor balance and flexibility contribute to falls and broken bones, also diseases like osteoporosis, which is a disease where your bone density, you become more fragile and you are more prone to fractures and breaks. And these fractures can result in significant disability and in some cases fatal. Resistance exercises, when done properly and through the full range of motion, increase a person's flexibility and balance, which decreases the likelihood and severity of falls. There was a study done in New Zealand that women 80 years of age and older showed a 40% reduction in falls with simply adding resistance training to their lives. Next, strengthening of bones. Postmenopausal women can lose 1 to 2% of their bone mass annually. Results from a study conducted at Tufts University, which were published in the Journal of the American Medical Association, showed that strength training increases bone density and reduces the risk for fractures in women ages 50 to 70. Reduces the chances of obesity. Proper weight maintenance, resistance training is crucial to weight control because individuals who have more muscle mass have a higher metabolic rate. As I said earlier, muscle is active tissue that consumes energy, and it's a lot more active than fat storage. Diabetes control. More than 14 million Americans have type 2 diabetes, which is 300% more than 300% more since the last 40 years. And the numbers are steadily climbing. It's an ongoing, you can tell, there's no plateau. In addition to being a greater risk for heart and renal disease, diabetes is also the leading cause of blindness in older adults. Fortunately, studies now show that lifestyle changes such as adding resistance training have a profound impact on helping older adults managing their diabetes. In recent studies of Hispanic men and women, 16 weeks of strength training produced dramatic improvements in glucose control that are comparable to taking diabetes medications. Additionally, the study volunteers were stronger, gained muscle mass, lost body fat, had less depression, and felt much more self-confident overall. Healthy state of mind. I always say if you look good, you feel good, you perform good. And I think that's the best. I have experience from that. My junior year, I was a little bit overweight, about 260, and I came into college, you know, thinking, I'm a freshman, I'm going to college, and gotta impress the ladies, I can't look like this. So I lost 60 pounds coming in. I weighed 180 coming in my freshman year. I think it was a great accomplishment, and it did. I felt a lot better. I was happy. I actually smiled. There was, you know, I'd look at older pictures, and I'd look at it, and I wouldn't want to look at it. But that's one of the pluses of resistance training, just the physiological side. Strength training provides similar improvements in depression and as antidepressant medications. Currently, it is not known if this is because people feel better when they are stronger, or if strength training produces a helpful biomechanical change in the brain. It is most likely a combination of the two. When older adults participate in strength training programs, their self-confidence and self-esteem improves, which has a strong impact on their overall quality of life. Sleep improvement, something I feel we all need. People who exercise regularly enjoy improved sleep quality. They fall asleep more quickly, sleep more deeply, awaken less often, and sleep longer. As with depression, the sleep benefits obtained as a result of strength training are comparable to treatment with medication, but without the side effects or the expense. Healthy heart. Strength training is beneficial just as much as cardiovascular training. In fact, it's kind of a common misconception that you burn more calories running on a treadmill than you would actually lifting weights. Strength training is important for cardiac health because heart disease risk is lower when the body is leaner. One study found that cardiac patients gain not only strength and flexibility, but also aerobic capacity when they did resistance training 3 times a week as part of their rehabilitation program. This and other studies have prompted the American Heart Association to recommend resistance training as a way to reduce risk of heart disease and as a therapy for patients in cardiac rehabilitation programs. Question? Nope. I have a handout for you guys. Why should you incorporate resistance training programs? I mean, you guys are, I don't think anybody in here is over 40, but I'm one of my dad.
But it's never too early.
Are you calling 40 years old, older adult?
I mean, that was my answer. Not those. Are you over 40? I wouldn't think that.
Not over 40.
See? Okay. My grade is on the line, huh?
So I have a question. So is there a difference from younger adults strength training versus older adults strength training as far as benefits?
For the most part, yes, because as for an older adult, as you spoke, it's from the aging process. As you start aging, I mean, like I said, the first thing that goes is your muscle mass, your strength, and ongoing. And as far as like, you mean by workout prescriptions?
Sure.
Or programs?
Yeah.
No, you can. It's just intensity and volume. That's all you'd have to switch up.